So welcome to this podcast. Thank you for tuning in again. This podcast is being recorded in Leipzig at the annual meeting of the German Society of Nuclear Medicine, and the year is 2023. Just hoping that people in decades to come will still watch this.
When they find this amidst the ruins, they'll know how to date it properly, and not by our wardrobe.
That's right. Well, my name is Thomas Bayer, and it's a particular honor to have Jim Williams with us. Jim is the CEO of Siemens Healthcare Molecular Imaging, and he has had a busy day, but made time for this interview, which we invited him to just yesterday. Jim, I have the pleasure of knowing you for a couple of years, but perhaps many people in the audience don't know you yet. Tell us about your journey and where you come from and what made you choose the profession and the position that you're in now.
Yeah, well, sometimes you don't get to choose your profession; it chooses you.
The chosen one.
No. So some people have like a life plan, and they say, "This is what I want to do. By the time I'm 30, I want to be here." I just have really a short attention span. So, and I wanted to be a scientist. So those things actually don't go really well together. So I was able to complete the training to be a scientist, so I could put the scientist badge on, but couldn't focus on anything for long enough to really be good at it. So I actually I found my feet in industry. So I went to the corporate research labs of Siemens, where I was working on different things all the time. So it was nice actually to be working on a variety of stuff.
Or was it because of the short attention span that you changed subjects so frequently?
Probably the short attention span contributed to that, but it actually worked in that environment. Whereas in some academic environments, you would not do well with a very short attention span. I really respect scientists that can focus on something for 10 years or 15 years and finally reach a result and really, be the X person that does this science. But that was never going to be me.
But as a spoiler, don't you do this also in industry? I mean, thinking of product development plans, essentially you come up with an idea that does not necessarily make it into the hands of a customer within a short attention span, a year or so.
Yeah, but you can have other people work on it, and then you can come back to it.
All right.
And what is really helpful is I come to places like this and talk to a lot of very intelligent people who are very deeply rooted in their research and in the community. And I can retain some of that and bring it back into help shaping the strategies of what we're going to make for the future. And I find that interesting. That's gratifying. The most gratifying thing for me is to actually make something that someone wants to use.
Right.
And that helps someone. It helps a patient. They want to use it. The physician wants to use it. The patient is helped by it. It's more tangible for me than any paper I ever wrote. Well, not that I really wrote really good ones, but just.
Well, let's take part in this journey. You mentioned you studied, and I think it was computer science you started out with.
And electrical engineering too.
Electrical engineering. Now, I took the liberty of tracking you on LinkedIn, and it says this nice
phrase. Me?
Well, I try to paraphrase. It said
that's all where those hits came from.
You started as an independent hacker, which somehow over that period of time overlapped with the studies. Who paid you at the time? How did you make a living?
I was actually lucky that I didn't have to pay much for my studies. So that's different from a lot of people who go in the U.S. and study in the U.S. My university studies weren't very expensive. And then graduate school was kind of the opposite. I got paid to do that. Some of it by the Defense Department. But the word hackers actually used to be a great word. But it essentially was a tag you would attach to yourself. I like to see how things work. That kind of goes to taking things apart. Taking physical things apart, taking non-physical systems apart, not for any malicious purpose, but just to understand how they work and to see how you can reverse engineer to understand maybe how to make them work differently or to your advantage in some way. But I think the word hacker has kind of been co-opted from being something that was actually a title of respect or a title of a meaningful and non-malicious word in the past to something that's really associated with people who try to use that same type of what was formerly curiosity, now kind of malicious curiosity, to
Politically indecent.
politically or to enrich themselves, which has kind of killed the word for a lot of people.
So when you got your BSc in computer sciences, you moved on to a PhD studies in engineering,
All right,
which I understand was at the university that has been quite known for its endeavors in nuclear medicine, right? Was that the trigger point for you, or did you
totally
notice?
none of my background has anything to do with nuclear medicine.
Okay.
So everything up until that point was kind of abstract. So my PhD work and when I was at Hopkins, I did two things. One thing was, in order to pay for my studies, I built or contributed to a group that built cameras for military purposes, different kinds of cameras that see in different spectra and look into the polarization domain and all of the processing and electronics behind those specialized cameras that had a purpose. That kind of paid the bills. And on the other side, I was working on really abstract topics, which were motion control for computer-aided surgery and for robots working on people, which was actually the thing I was really interested in. And my dissertation is kind of a mess because of that. But on the good side, glass half full, it really prepared me well for what I do now.
Mm-hmm.
So, the old word for a scanner or in nuclear medicine is a camera. And there's a lot of similarities: high-speed cameras, noise level, electronics noise level, everything you learn about, building your own retinas on chip. That was stuff I had to do to pay the bills when I was in grad school, but didn't publish anything about. And the other side, at least, was what I was interested in. I knew I didn't want to build defense hardware for a lifetime, but I was happy that it was, and I'm grateful that they were able to support my education for the duration of my PhD.
So after your PhD, I understood, hopefully this is correct, you went to corporate research
In Princeton
in Princeton.
for Siemens.
Okay. Tell us about it. Why
So-
there? Well, what took you there? Luck again or random?
Random chance.
Okay.
I knew someone working there.
Yeah.
They gave me a call when I was near graduation and said, why don't you come and see what we do up here, an interview? And I did, and I ended up there for, I think, 5 or 6 years. And it was a really good time. We were doing the first 3D angio systems. And I made like the one and only really like highly cited patent when I was in like my first 6 weeks there.
Wow.
And then after that, everything else was crap. But
Could still be cited.
it could still be cited, but probably in a negative, pejorative way. But in there, we were working on the first 3D angio systems. So, neurointervention, being able to use cone beam reconstruction, it was fascinating stuff to work on. And they got a mix of things that you could do. You could do segmentation, registration, all of the kind of the heyday of the early days of medical image processing, rendering, high-speed volume rendering, also an area of investigation at the time. So all the technologies that we kind of find to be just standard things you expect today were something novel at the time.
So Jim, I'm interested in understanding your perspective on being a scientist and researcher in a corporate lab versus being a scientist and researcher in an academic non-for-profit lab. And you mentioned this meeting, so you clearly meet a lot of people who work as researchers in non-for-profit organizations. Do you think there is a difference in the scientist's mentality?
Well, I think when you, and I really can't speak for the academic world, in any authoritative way. But there's different objective functions. So if we reduce it to an optimization problem, there's a different objective function in academia, and developing a reputation, being cited, having your work cited, having it become the foundation for future work, which benefits someone or something is the core of kind of academic pursuit, that type of impact. Whereas in industry, it's often taking something that may already be in that state, known to be possible, shown to be feasible, or at least limited and feasible, and make it reliable and repeatable, to make something that works every day when you press a button. And that's a challenging problem, a surprisingly challenging problem, to make something that works every day and in every environment that it could be presented with. And it's fun. It's very challenging, and it gets you into a lot of aspects of practical engineering, as well as the theoretical aspects, all the way up to the abstract mathematical aspects of, working with a configuration space of a many-jointed robot so that it moves smoothly and doesn't, throw the X-ray tube halfway across the room.
In my experience, I would add to this that in academia, I sometimes feel is very personal. The research you do, you actually need to describe it very well. You need to make sure, given the boundary conditions, that you can promote yourself and you actually make an academic career. Whereas in industry, and I was working in academic research before, it had more of a group feeling to it, because you were working, in my experience, for something bigger that people had to join in. So I felt it was more solidaric, if I can use this term. And people might prove me wrong, but this is my experience.
Well, I mean, you have a very hard objective, but you have a very hard criteria of success. That's, does the thing work? And it's much more tangible when you're building a device or a piece of software that has to work repeatably, and also the bar is lower for what it has to do than one would have as a bar for publication in academia. So, and naturally, it's not that critically important to be the the first author.
Yes.
Nor is really the idea of tenure really
Right.
it's really a thing. So at least for in regard to the U.S. academic system, if you take out your need for authorship, your impact score, and your tenure portfolio out of the picture, I think it allows you to at least spend less time focusing on those things and more time just working. But there's also the other aspects to it where you have to fulfill a lot of regulatory hurdles and other things, which might be, like would say, with the downside of the work.
Mm-hmm.
But it's also a challenge in itself.
Having worked in corporate research, does that equip you with character traits and skills that make it easier for you to communicate with researchers that come to you and your company and say, I invented this, I'm the biggest in that, and we need to work together?
Boy, I wish. No, it does. I think that coming out of a scientific or a research background or a very hardcore engineering background, may be a better fit for the nuclear medicine business than someone with an MBA. Not that I have anything against MBAs, but they really, really don't help you a lot with understanding list mode reconstruction.
That's great. Jim, you worked at Princeton, and then I understand you moved to Siemens Erlangen, right?
Forchheim.
Forchheim is, excuse me, yes.
That's the hub of the universe, Forchheim.
Yes. Sorry, Frankovia, Forchheim. But you joined a division within that company that deals with X-ray and fluoroscopy, right? Why that? Why did you start there?
I got an offer.
Okay.
And there was a really cool project going on.
What was the cool project?
That was the first time we combined an industrial robot with an imaging C-arm. Wow. So it was the first project I got to work on. Very attractive. It was called the Zigo at that time. And getting that thing from a prototype, or being part of a very big team, which, very selfless and a very cooperative big team, to solve it, not all the problems, because we didn't solve all the problems of the first round. We solved 2/3 of the problems of moving that industrial robot into the role of a medical device was a lot of fun. It was just interesting work.
So what was the mantra when you worked there at that division for you? Well, you clearly go out to customers and you have to express a sort of enthusiasm. Well, what was the enthusiasm you expressed for that domain of medicine?
Oh, I mean with in interventional radiology, for instance, the difference between that and almost every other aspect of medical equipment design in medicine is that your user, the one who sits there at the console and operates the levers and uses, and is inserting a catheter and maybe deploying a stent, they're using your machine as their workspace. So the physician, the interventionalist, has that machine as their workbench to be able to help that patient. So their relationship is with the machine, and that's a very, very close relationship they have because they spend 8 hours, 10 hours a day deeply vested in that relationship. So you better make sure that that relationship goes well. In a scanner, the relationship between the physician and the device is really a relationship between the physician and an image. So the operation of that scanner is something that's largely in most cases left to technicians.
Outsourcing.
It's outsourced, and the value of that thing is really, really focused into that image. Whereas the Bedienungskonzept, the whole user interface of the
Correct is American.
sorry, I'm at the DGN. I had to switch on German for a while.
And kudos to your German. Honestly, you speak German very well.
You're not allowed to do engineering in Germany unless you speak Franconian. Paschal.
You described this, obviously, that interaction with a robot as something you're very passionate about. And then when you described the scanner relationship with the doctor, it was like the relationship goes a bit sour because they only look at images. But you ended up in molecular imaging and healthcare. What drove that transition?
Again, opportunity.
Opportunities?
It was interesting. There was offered a chance to do it, and it was an interesting thing to do. It's totally, like I said, very short attention span. Although I was I think nearly 10 years in Forkheim with angio, and then I've just been 10 years now in molecular imaging. But it's a whole different array of things to work on. And I was telling my kids when I was transitioning jobs, I said, it was really cool here, and I got to work on giant robots. So giant robots are cool, especially if they're fighting. Okay, if they're doing medicine. But I said here, even cooler now, it's antimatter.
And it sounds like you leave your kids behind and you just described them what was great in the past. But they joined
the antimatter.
Yeah, okay, so strategy.
Yeah.
Okay, good. The Da Vinci principle.
Yeah. So yeah, it's we're moving up in the world from robots to antimatter. It's all the sci-fi, kind of.
So sticking to that sci-fi mode, what is so attractive about molecular imaging? I'm sure your kids have grown up now. If you were to speak to them now, they are past that age about antimatter. What is great about molecular imaging?
I mean, antimatter is still cool, no matter how you think of it. But as opposed to maybe other imaging modalities, molecular imaging is a therapeutic discipline as well. I mean, nuclear medicine. I actually prefer the term nuclear medicine.
Really?
Yeah, because one, nuclear is fun because it scares people, and medicine because medicine. It more accurately describes what's going on because of the therapeutic aspect of the discipline.
I have an interim question. So we are in Germany. We know that a few days ago, through a government-driven law, all the nuclear power plants have now gone quiet. They're dead. We actually recuperate part of it through nuclear energy because we buy energy from France, where 70% of the nuclear power feed the energy grid. But as a businessman, wouldn't you say that the term nuclear is negatively connotated, but yet you make it sound like fun presiding over a business that should be called nuclear medicine?
The negative connotations of the word nuclear in Germany are probably many times greater than they are in some other parts of the world. Let's not even go with Japan, but I live in Knoxville, Tennessee. And why do we build PET scanners in Knoxville, Tennessee? And honestly, the short answer to that is the Manhattan Project.
Yes.
So we're very close to Oak Ridge National Laboratories. Oak Ridge made uranium for the Manhattan Project, or separated uranium, and a whole field of radiation detection built up in that area. And then eventually, and you know very well, Thomas, it led to the core technologies that enabled PET scanning, which has been a great benefit. So I don't see it one way or the other, that nuclear is a negative word or a positive word. It's an accurate word.
That's a very good. Yeah, that's very cool. Staying in this field, nuclear medicine, you actually joined nuclear medicine or molecular imaging and therapy at a time when I would argue, have just seen the first wave of installations of hybrid imaging technologies pass, and the concept of theranostics set in because for the first time the market opened by pharma companies buying into this concept and commercializing tracers and therapeutic products. What do you think has changed in nuclear medicine over the years, and where will it go? What's the trajectory?
Oh, I entered the field knowing very little about it in 2013. And I have to say, I still, compared to a lot of the people here and you, I know very little about it, relatively. Enough to be dangerous. But when I started in 2013, I traveled. I went everywhere in the world where nuclear medicine was being practiced, or almost everywhere, and I talked to people. And it was interesting. So I went to Asia, went to Japan, went to China, went to India, asked them, why don't you have any SPECT? And they had a really good answer for that, because well, we have PET and angio, so why and that was and for their model, that was actually the right thing to do. I went to the States, and everyone is very depressed about it in the field, or not everyone. There were a few people who were still optimistic, but it was a very dark time. They were saying procedure volume's going down, nothing is new. Cardiac volume, that we do for cardiac patients is getting replaced by other means, and there's nothing on the horizon. And then I actually went back to Germany. And in Germany, there was this whole universe of discovery going on. Amazingly rich community, a rich research community, and with both diagnostic and therapeutic applications. So you had people already, I asked, in the US, I'd say, what about prostate cancer? And they'd say, yeah, I don't know. I've heard it, there's a little bit of work in F-choline, and, aside from that, it's not really interesting. And then you go to Germany, you would go to Germany, and a year later, I don't know when the first lutetium PSMA therapies were performed under, essentially the equivalent of the Arzneimittelgesetz and the compassionate use. But they were already rocking there with lutetium therapeutics, and very far along, with promising results. And even today, it's still an amazingly innovative hotbed of research. I mean, the rest of the world has kind of caught on, but this was the place where it revived. This has rekindled the field, I think.
But where do you think the field will be going?
I think you'll continue to see therapeutic development. Not every therapeutic is going to succeed. The first two, we had really good evidence out of the German experience that they worked, and then they were able to move that to the rest of the world. The many questions you have also about the type of radiation delivered in therapy, alpha beta questions, have a whole lot of runway ahead of them. The possibility and what happens when you move therapies earlier into patients becomes a really, really valid question now, because maybe you can move them a few earlier. And then there's ancillary questions that you need to answer there. When are we doing less harm than good?
Yeah.
So when are we doing minimal harm? And that has a lot to do with radiation biology of tissue, in exposure to radionuclide therapies. And I think that's a place where, especially with alphas, we still learn things on a regular basis, and both in the animal models and in human.
What you touched on with your description is that nuclear medicine is actually a multidisciplinary field. It's a bit of internal medicine. You touched on oncology, neurology, cardiology. So it's really an overlapping field that caters to many domains in medicine, if you will. Now, especially with theranostics, I have the impression we're storming the turf of oncologists or radiation oncologists. Do you think that through the introduction of theranostics, there is a risk that the nuclear medicine specialty needs to, I don't know, is breaking apart or needs to redefine itself? Can we still talk about a singular specialty?
Uh, perhaps I could take the example from interventional radiology. In the beginning, there was interventional radiology, and then there was interventional cardiology. But interventional radiology still remained the ursprung, or the source of all of many of the future developments. So maybe in nuclear medicine, you see, someone who specializes in the therapeutic side and delivery of the therapeutic side and managing patients, because perhaps there's enough depth there that it really is best done by a specialist in that area. And then there's the diagnostic and also the future research side, which I think, forever you need essentially a kind of breadth of understanding. And it's where being a specialist in a particular field, internal medicine, being an oncologist, having a background in neurology, and on top of that, being in the field of nuclear medicine, becomes a kind of necessary background knowledge to be able to at least develop therapies and come up with a hypothesis of how you might treat a disease.
Well, what you're describing is a need to look beyond boundaries, beyond individual silos, right? Need to be a cross-specialty specialist, if you say. I don't know if that term exists.
I think you can be more than one thing.
The reason I'm asking is that we had a chance to interview a colleague of yours and we spoke about silos. And in science, we see a need to break down these silos because there is no sustainable way for all scientists to go into the depths of an individual aspect without looking left and right. In fact, things that are developed in one domain could be repurposed to succeed in another domain. I find industry, if I can be a little bit confrontational, still a bit far away from that, because industry, or let's take healthcare, is still very much built on top of imaging modalities, silos. And I take the example that you know very well, hybrid imaging, and you alluded to me having that experience. When we started hybrid imaging, we fought tremendously coming from the pit side to get the attention of the radiology domain of the industry partner and giving us the latest CT technology to partner the PET with and build a proof of concept system. And there was a high level of resistance, again driven much by a large silo thinking. Why is that? Why is there so much construction around imaging modalities when healthcare should be modality agnostic, really?
In order to make something that works, you need to spend a lot of time learning about how to make that thing that works, and that kind of thing. So it tends to favor specialists in the engineering side that may have 10, 15 or more years of experience in a particular domain because they know what to do. So it takes a long time to train an expert in a particular field. And if you have an engineering group making a device, you tend to design the engineering group so that they have all the necessary capabilities to make that device. And I know you take an engineering group that is focused on building MRs, they might take a while to be able to understand what's important about building an ultrasound machine. So you need that specialization. And I think you also see the same kind of specialization in academia. In order to make progress in certain areas, you need to have depth. You need to be rooted in depth in that area and understand also the breadth of that particular area to be able to build something beyond what is already extant. Now, in order to change, you also need breadth. You need to look across. So it's not really an either or. I think if you had a bunch of non-specializing specialists, everyone's a jack of all trades. You have a lot of things. You would probably have a lot of devices that didn't work very well, honestly, because a generalist is terrible at building a specific thing usually, but a generalist is great at coming up with a way to put the two things together, like a hybrid modality. And someone who has a little more generalism is required, I think, to move forward to make new things. And it's sometimes I think the looking across fields most of the time is where you find the things that are probably more revolutionary.
And how do you support this looking across fields? Do you have innovation ambassadors that are free floating across the different silos, if I may say so? Or how do you make sure that people in CT know about ultrasound, MR, etc., etc.?
Yeah, not very well. I think I kind of see it, for instance, as people who have the ability to have that visibility across modalities should take advantage of it. So I see it as an obligation that minimally I and other people that have some freedom over the time spent in different disciplines spend that time and ask questions about what can be done. And also, I think that's a great source of working with both academic and clinical people who have a different view and will see something from a totally different vector kind of in the space. So they have a different set of basis vectors for the space, and that may be a disease-based view where it's very agnostic to the modality. And that's why it's so important to listen to someone who may be an expert in a particular disease, Parkinson's disease or cardiac myopathy, something that have that specialist there, and then they have a generalist view of the techniques for treatment and diagnosis. And I think that's the way that we can best. If you understand a disease or a pathology, it helps you cross those boundaries.
On that note, you as an industry do not only sell products, which of course drives your revenue, etc., but you also take a sincere interest in working with your customers, be it through, predefined research projects or collaboration, trusted relationships. Why? So what is so important about not just handing over a machine, but staying in a, long-term relationship with the customer?
Oh, it's only the value of that machine to a patient is really mitigated through the clinician or the scientist who is working to develop a treatment for that patient or be able to diagnose that patient. If you don't know the consumer and what their needs are, there's no way to build the thing that they need. And that kind of goes back to the beginning. You want to make something that someone needs and helps them. And if you don't know what they need and you don't know what helps them, you're not going to make a very good product.
Can I take this as an example and ask you about one particular product of yours which now rivals the market?
Oh, good Lord, is it?
The concept, because I think, let's talk about total body PET systems, all right? So this is a technology that allows to scan or cover the politically correct term is extended axial field of view. We're talking about, 70 to 150 to 2 meters at once. And this is a new concept in the sense that a machine is provided that really offers a large axial field of view coverage with all the bells and whistles of a PET system. What is so great about this? Or let's talk differently. An innovation is an invention plus value. What is the value of this type of machine and what made you choose invest in it?
Yeah, and in this case, I can tell you probably where our assumptions were flawed. Seriously, when we did this very quickly, so we built it we built the Quadra out of visions in a very rapid way because of what we saw as scientific potential. So there's the answering scientific questions that, multi-organ interaction, something you're working with, having very high sensitivity going out to, extended 2-3 half-lives out. You could ask a lot more questions. You could pose a lot more questions scientifically than you can with a more conventional scanner. However, to our great surprise, when we brought this out, of course there was a huge interest in the scientific potential of this in the university hospitals, but it also turns out what we didn't estimate at all was how practical it would be. And it turns out that it allows you to just totally change the way you do departmental workflow because of the rapid imaging time. And we weren't as focused on that as answering those other questions, but now it seems it does both. But the reason that it can find adoption as opposed to maybe other more esoteric yet expensive devices like a Meg or something, is that it does everything that a conventional system does, just way better, but also helps you answer the scientific questions. And we really underweighted that ability to change departmental workflow and economics.
There, I would argue, is clearer patient value, which I see most in the provision of ultra-short scans. I have to admit, rather than lowering the dose, although I appreciate that this is important for certain centers. But what I'm very curious about is this angle here, this trajectory about doing physiologic multi-organ imaging and assessing response to stress interventions. Now, when you think about this, you know this actually very well, this field. It requires the reach out to professions other than nuclear medicine physicians, internal medicine people, complexity science, network medicine people. And it actually opens up a space that I find nuclear medicine has not really set the foot in. What do you recommend nuclear medicine should do as a community to explore this path more effectively?
Maybe to put it simply, there's always a clinical opportunity, opportunity to treat patients more effectively in a place where you have maybe already developed a wide array of therapies, but don't have any good quantitative effective diagnostics, or root cause based understanding of the condition. So understanding the root cause and the early etiology of disease makes a big difference into how a patient can be treated in some cases. We'll look at the case of prostate cancer and PET and the explosion in that area. We introduced one kind of therapy, but actually introducing the diagnostic also was a big step forward. Prostate cancer is a field where there were already existing diagnostics, there were screening tools, and there was an enormous array of therapies available. Just being able to more accurately assess and determine a therapeutic path for a particular patient was an advantage in itself, even ignoring the theranostic aspect, which is also becoming quite prevalent right now. And that understanding of systems, the systems origin of disease, is a way to better use your tools. If you understand where something comes from, you're probably better suited to understand where to treat it. And I look right now even at our understanding of Alzheimer's disease. I think we have a way to go there still.
But you are suggesting that we should open up the parameter space and not just, if I understand you correctly, we need to position our modality, molecular imaging, in a larger context of other, parameters for disease models.
There's two sides to it. One is understanding theoretically what's happening and being able, and then there's translating that clinically. And I think we need to do both. So sometimes understanding theoretically what's going on, or understanding in a quantitative way what's going on in a process, may not translate clinically, and we have to be able to accept that as well. But we know more, and it may be useful to someone else. It may not provide more, it might not provide a nuclear medicine diagnostic procedure or treatment procedure. It may provide effective information that could help pharmaceutical manufacturers create something new, or even, when you're looking at the question of stress and anxiety in a patient, just understanding those pathways may help at least underscore the need for reducing the negative effects early on, and understanding that, may bring, simply by bringing that understanding to clinicians, that there's a defined, visible, quantifiable pathway that for instance, goes from amygdala activity to heart disease, can be a benefit.
If I can be, and it's not supposed to be a trick question, you basically do how should I put this? A suggestion, you're given a suggestion to academia to broaden their horizon, interact, try to understand the foundations of their observations. How is that mirrored in industry? Are you waiting for something cool to come out and then you react to it? Or can you actually support this in one way or another? The reason I'm asking is that I personally believe we also talk about big data, we talk about multi-parametric data space, where academics typically lack functionalities and tools to get easy access to this. So we've seen presentations on AI, on automation, etc., where you guys clearly lead the way. How can we benefit from each other's competencies there?
Well, that's a long, multi-part question, Thomas. And the first part is, what I recommend. I do not recommend academia to do anything differently. Just continue to be curious and continue to be incredibly intelligent people who are driven to, answer questions that arise out of their work. That continues to be, and to be interested. And that's important as well. And I think in industry, we need to maintain broad interest and have people that are able to cross-fertilize and have interest in everything. But this, again, I may be just projecting a personal lack of ability to focus on anything for to being interested in everything. But at least that's the way I like to approach it. Be interested in everything.
Adding on to this, I have a somewhat personal question. So you're an American citizen. You spend most of your time when you don't travel in Germany. You actually
No, I live in the U.S.
You did present yourself in Germany, now in Knoxville, Tennessee, but you are really an internationally presented individual. So I want to understand, how important is it to keep one's radar open, to not only expose yourself to different countries, different cultures, but to also work with different cultures? How important do you think that is, especially in these times where we see more and more nationalism coming up and crisis and even wars?
I think sitting in a lot of needed development meetings in Germany with over 50-year-old German white males, being the only one of those that wasn't one of those in the room, taught me to appreciate diversity in groups and different ways of thought, because the more homogenous you are, the more homogenous the assumptions of the group are, at least in my belief. And the less likely you would be to explore something that's assumed to be a no-go path, or in fact it might be something quite interesting. The fact that cultural differences, gender differences, age differences, all of these things are positive contributions when you're trying to find a creative solution to a problem. And I think that building a team that way is important. And there are only certain places in the world where you can do that and have be that inclusive. And I think the places in the world that are able to build diverse teams are going to be better at creatively solving problems.
From a leadership position, what is the glue that holds together a diverse team?
Oh man, I wish I knew that. I think
Is it trust?
Trust is important, and I think common interest is as well. So to be interested in a lot of people are drawn together. You see in clubs or attractions because they have a shared common interest. It's not that hard in the science and engineering side because the people share a lot of although culturally they may be very different, they're interested in a lot of the same things, the same problems, the same fundamental interesting phenomena that occur. And I think that kind of sense of wonder, it helps with at least teams of scientists and engineers who are not competing in some kind of zero-sum environment, and that helps too.
But you still need to create an environment, an ecosystem that makes them feel comfortable, right? Curiosity alone or a common interest is not taking it home, right? You need to support it from your position as well as from the angles of HR, etc., etc.
And to foster that, I think there's a lot of different pathways to get there. But you have to give people the freedom to explore, but give them enough structure to know which direction we need to go in.
Okay.
Yeah.
Towards the end, if I'm a little bit facetious, I would say to become a great leader, you need a short attention span, if I take you as an example.
No, I say first off, your first assumption can be debated, and having a short attention span at least lets you be interested in many things. That's my pathway to be interested in many things. I think you can be a very focused individual and still be interested in many things. I just am interested in many things and slightly deficient in intention.
So I give you an anecdote. When I started in Vienna, I interviewed a PhD candidate and I said, well, what do you want to be? And he said to me, I want to become a professor. So if I translate this, if you had an individual who interviewed with you and said, I want to become a business leader, what would be your reaction?
I would ask the question, why?
I can give you the answer, what he said, which was very interesting. He said, because I enjoy teaching, or translated, I enjoy mentoring, which I thought was a great answer.
And then maybe his answer was really, I want to be a teacher because I want to teach.
Okay.
So, I want to be a professor was the answer, but I want to teach was the wish. Yeah. What?
It's not passive being a professor.
It's totally worth it.
Jim, if you had a candidate come to you, and we talked with other kind people who were kind enough to be with our interview partners, if they had someone from the younger generation being insecure about a professional choice, what would be your first question to them? I know it's kind of an ambivalent question, but if someone came to you and said, Jim, I want to come to industry, I want to be a researcher in industry, what would be your first question?
Well, again, why? And I think that's the only question on both sides, in industry or academia, that is the primary question, why and then how. And if someone said, I want to be a researcher in industry, and they said, when I asked them why, they may get a lot of answers. If you had asked me, it might be because I'd say, I want to make something that actually works, that works in it's satisfying to make something that works very reliably sometimes, but that's not everyone's wish.
Can we make nuclear medicine, that's your preferred term, can we make nuclear medicine more attractive, and does it need our action, or is it a self-fulfilling?
I think it's making itself more attractive right now.
Okay.
But I think it is important to provide opportunity for people who want to enter, and I think the thing we can do most now is provide opportunities, fellowships, and support for people who want to enter the field at the start of their careers.
And together we can, I would say, somewhat pathetically. At the very end, I want to ask you, like we ask everybody, do you have a mantra of life to share with our audience? What's your mantra?
Oh wow, that seems kind of prescriptive. Yeah.
No. But you have a very good way of phrasing your ideas and your picture.
If you wanted to say, continue learning and be interested. Never stop learning. And I think if you decide you're done with learning, you're pretty much done with change.
All right, that's a wonderful finish to a great interview. Thank you very much for your time. Thank you for letting us in on your thoughts, and thank you for watching.
Thank you.